but we're going to start here. Perfect. And I do just also want to give a note before we get super into the data here. A reminder of what 211 Virginia is that we are contracted through VDSS. So we do have annual appropriation from the General Assembly. We know we invited some elected officials and their representatives today. So if you are on the call, thank you so much for that. And thank you for that annual appropriation. And we are also operated by the Council of Community Services, which is an independent nonprofit that contracts the 211 Virginia services. So we're kind of a public-private partnership. We've got our toes dipped into kind of every area of the human services sector. And so wanted to contextualize that for y'all before we continue to move into the data today. And with that, I am going to move into our data definitions. So if you've been with us this morning, these might look familiar to you. These are also available in every single report that we release. This is a page, so you will be able to find this. But just to move through it quickly, when we talk about an agency, we are referring to an organization, and that's going to be, they have at least one service listed with us. And we pulled that information on June 30th of 2024. So it is as up to date as it possibly could be for the time period we're talking about today. When we talk about a program listing, that is referencing a specific service provided by an agency. And these are what we actually refer people to. So we'll give people the information on the program listing, not just your agency information. When we talk about a program type, and you may hear me use keyword, I try to stick with just program type, but if you hear me say keyword, I mean the same thing. These are just descriptors for our services that are classified by our taxonomy that we adhere to. That's from our accreditor. We use about 440 different program types and keywords to cover over 700 taxonomy terms. So we will not go into all 440 today, but just so you have an idea of kind of the scope of service and classification that we have going on. When we refer to individuals or inquirers, that is going to be the estimated number of unique people. We are a very low barrier to access service. So that does mean that we do have some anonymous callers or some information that we're not able to track as well. So it's an estimated number, but those are people that contacted us at least once in the last fiscal year. Whereas contact is going to capture that total number of contacts we receive. So an individual might contact us 4 times. That's one individual, 4 contacts. Then referrals given is the number of resource referrals that we provided in the fiscal year. We try to give multiple referrals per need request. So you'll see individuals number is going to be the smallest, contacts should be a little bit bigger, and then that referrals number should be 2 to 3 times bigger. So we try to give at least 2 to 3 referrals for every contact. We are also today going to reference some numbers from the United Census Bureau and United for ALICE. These organizations collect data specifically on our ALICE households, which are asset limited, income constrained, and employed. We really enjoy looking at these reports. We think they provide a lot of context to the data that we provide and share with y'all. United for ALICE does a lot of really cool data mapping and work. I personally spend a lot of time on their website, just kind of clicking around and enjoying the data dashboards. That's me revealing my own nerdy hobbies and side time, but really enjoy doing that. And the numbers that we look at today, like I said, are just going to contextualize that data. I also welcome you to kind of explore those reports. We'll be citing them a couple different times throughout the reports today. And just a reminder that that ALICE population is households that earn above the federal poverty line, but below the cost of living in their area. So it kind of expands what we're thinking about when we think about what communities might still be in need and unable to afford the cost of living. So we will kick off by talking about community utilization. So when we're talking about community utilization, we are talking about who is using 211, how often, and where they're from. So in the Northwest region, and you'll see a reminder of where we are, Northwest region is these planning districts in the green highlighted up in the top corner. We're looking at a population of just about 1 million people. From that million, we had about 5,600 contacts. And again, that's all of our phone calls, emails, texts, and chats. And that can kind of be an indicator of need in your area or just an indicator of demand as well. Those 5,600 contacts were spread across 4,500 unique people. So we have a pretty good sample size, but definitely could be getting more of the population in there and using 211 more often.
And within Northern Virginia, huge population, 2.7, over 2.7 million total estimated number of people living within the northern region, with 17,600 plus contacts, whether by phone, email, chat, or text. So again, that number indicating kind of the need in that area. And then 13,300 plus individuals, so the estimated number of those unique individuals within Northern Virginia who are the northern region that are contacting 211.
Yeah, so big numbers up there in Northern Virginia. Coming into Northwest, we're going to look next at our contacts by planning district. So on this graph, you can see that the dark green is going to be representative of the contacts that came in from the locality that generated the highest number of contacts, whereas the lighter green color is going to be every other locality. So those two bars together are our totals. You can see those totals coming up here, always just about around 1,500, or in Planning District 9's case, just under 1,000. And then our localities with the highest number of contacts in Planning District 6, it was the city of Stanton. So again, that's represented by this dark green bar here. Planning District 7, we had the most contacts come in from Frederick County. In Planning District 9, we had the most contacts come in from Orange County. And then in Planning District 10, we had the city of Charlottesville make up almost a third of all of our contacts from that planning district. So lots of contacts from the city of Charlottesville.
I get to read just two planning districts, so exciting stuff. Just did Southwest with 5. So within Northern Virginia Planning District 8, you can see Fairfax County is the highest locality with the highest number of contacts. And then, as Mary referenced, all other localities within the lighter yellow. And then for Planning District 16, we have Spotsylvania County making up a good bit of their close to 4,000 overall contacts from Planning District 16.
And having been born and raised in Planning District 8, I will just say it's sheer volume. That bar is just going to be higher than almost anywhere else in the state, just because there's such a sheer high amount of people that live in that area. And if you've ever driven on 95, you know exactly what I'm talking about. Somehow all of those people end up on the same road, 4 o'clock. All right, and then looking at that contact volume, we have a little bit of a heat map for you all. I'm very excited about these maps. I'm very excited to be sharing them. And so this is contact volume. So any county that's red, which in this case, in this area is Fairfax County, means we received over 5,000 contacts just from that locality. So Fairfax County coming in very well represented in terms of contact volume. The orange, the one step down, represents between 1,000 and 5,000 contacts. So you'll see that's kind of the rest of Northern Virginia, kind of the rest of that region, coming down Loudoun all the way down to Spotsylvania. The yellow, which you'll see kind of spotted throughout both regions, is between 300 and 1,000 contacts. And then I just want to draw your attention to our blue areas. Those are really low numbers of contacts. That's fewer than 75 in those localities. Some of them are just a little bit more rural. That is representative of the population. For others, that might be community need related. So we'll get into that a little bit more as we go through, but just drawing your attention to Clark, Rappahannock, Madison, Greene, Bath, Highland, Lexington, Buena Vista, City of Fairfax, and the City of Falls Church, I believe, are all of our light blue. And as promised, we are going to get a little bit deeper into that contact volume. So contact volume tells us part of the picture, but it's highly related to population. We expect to see areas with more people living in them contacting us more often. So what we did to take it a step deeper is we're looking at those contacts relative to population. So this first column you're going to see here is the percent of the region's population that lives in a certain planning district. And then this column is going to be the percent of contacts that are generated from that planning district. So for example, in Planning District 6, the Central Shenandoah, which is where I live, that represents 31% of the Northwest region's population, and it generated 30% of contacts from the Northwest region. And you'll see all the way down, I'm not going to read all of these numbers, but you'll see that all together, these are pretty even. We're seeing 25 and 22, 19 and 17, 26 and 31. The biggest discrepancy we're going to see is in Planning District 10. with 26% of the region's population representing 31% of the region's contacts.
And then within our northern region, you see that it makes up 85% of our region's population, with 77% of Planning District 8 contacting 211. So pretty okay there, considering the mass population in that area. And then Planning District 16, George Washington, makes up 15% of the region's population, and over 23% of our region's contacts coming from George Washington. So again, pretty good community utilization.
And then we even wanted to take that a step further and look at localities, not just planning districts. So these are localities in both the northern and northwest regions. We highlighted the top 5, highest number of contacts relative to population. So the counties and cities that we're looking at here, we're kind of looking at, they're more likely to have a high awareness of 211 Virginia or a higher community need. So for example, in Prince William County, only 18% of the northern region's population is generating 25% of the contacts. So we want to take a look at Prince William and say, okay, are they just more aware of our services, that they're contacting us more often? Is there more need in Prince William County than there is in other areas? Why are they using 211 Virginia more often? And we'll ask those same questions for the other localities here, which includes the city of Charlottesville, making up 5% of the region's population, but 10% of contacts. And then Arlington, Stanton, and Waynesboro, all making up a pretty small percentage of the population, but a little bit larger percent of those contacts. And then of course, if we're gonna look at one, we have to look at the other. So over here on the flip side, we have the localities with the lowest amount of contacts relative to population. And these are localities where they're just not using us as much as we would expect based on their population numbers. So these may be localities that have either a lower awareness of 211 or lower community need. And like we talked about in our last section, that community need can kind of be explained a couple different ways. That may be represented by wealth, it may be represented by they're receiving information and referral services through other nonprofits or through, if they're close to the border of the state, maybe from a 211 from Maryland, DC, those kind of areas. So there's lots of different reasons that people might not be using 211 Virginia, whether that's need-based or awareness-based. And where we're seeing that and where we're kind of focusing and asking those questions is in Fairfax County. Fairfax County makes up 42% of the northern region's population, but only 29% of the contacts. Loudoun County, 16% of the population, but only 7% of the contacts. And then Rockingham, Augusta, and Frederick counties all make up about 10% of the region's population, but only 5 to 7% of the contacts. And then this is just a visualization of that information. So I really want to call your attention to the areas that are in an orange color. So Spotsylvania, Fredericksburg, and the city of Fairfax up here in orange. Those are going to be pretty high. So those are areas where utilization is high. And then where you're going to see it coming lower is going to be Caroline County, Loudoun County, Fairfax County, and Prince William County, all in that very dark green. That's where utilization is a little bit lower. And then another kind of, and Amanda mentioned, this is our only line chart. So it gets excited for some chart variation, you guys. We really know how to party here at 211. This is our contact volume over time. And you can see that the gold line represents our Northern Virginia contacts, where the green line represents our Northwest Virginia contacts. Overall, in both regions, contact numbers were highest in this August to October period. That's our back to school utility assistance starts. We know there's a lot of seasonal programs during that time. It also tends to be hurricane season, so we may be getting calls about that. And then in Northwest Virginia, we also had a big spike in March 2024. That is our tax preparation assistance season. So it's possible that we had a lot of contacts related to those kinds of needs. That kind of brings us to the end of our section on community utilization. So again, this was how often people are using 211 Virginia and where they're using it. So overall, utilization of 211 Virginia is generally low in the Northwest region. Historically, that makes sense to us. We haven't had as big of an outreach presence. I'm the first ever outreach person designated to this whole Northwest region of Virginia. So we know we still have a lot of work to do with raising community awareness. And then utilization really varies in that northern region. You have some counties that really use us a lot and some counties that really, really don't. So it's very, very varied in that northern area. And then the second point is that the ratios of contacts to population for planning districts is about the same. So essentially what we're seeing is about what we would expect based on population. If there's 25% of an area that lives in an area, then about 25% of our contacts come from that area. There are a few discrepancies. We did pull those out, but in general, each planning district generates a percentage of contacts that's roughly representative of their population. And then finally, this area of Virginia does mostly match our statewide trends in contact volume over time. We know that that August to October period is by far our busiest, but we did also have some spikes in January and March. So we've talked about who uses 211 Virginia. We've talked about kind of where they're from, what that usage looks like. Now we're going to get into community need. And to start off community need, we want to first kind of contextualize the communities we're talking about. This is where we're going to pull in that United for Alice information. So in the Northwest region, and again, that's planning districts 6, 7, 9, and 10, we're looking at 11% on average in that region, 11% households in poverty. On average across the region, we're looking at 30% of ALICE households. And again, that ALICE is the people earning above the federal poverty line, but not quite enough to afford the cost of living. And then a median household income in the Northwest region is just under $80,000.
And then within our northern region, and we like to highlight this because I think that there's this sometimes a narrative that Northern Virginia doesn't, our northern region doesn't need help, that they're, a little bit wealthier, that there's, maybe no one who needs these type of services. And we know that's simply not true. Though you'll see the average household in poverty is 8%, so a little lower than the other regions. But it is important to note that 28% average ALICE household. So as Mary said, that asset limited, income constrained, but employed household is at 28%. So that is a fairly big number when we're thinking about those individuals and that big population that maybe can't afford their basic needs or to make ends meet. Though this is, I believe, our only region that has a household income in six figures with over 115,000 and 613 as the household income as of 2022 for Northern Region.
Absolutely. And diving into those ALICE numbers. So what we're looking at here is a combination of the households in poverty and the households in ALICE. So when we're talking about under the ALICE threshold, we're talking about anybody that can't afford the cost of living and falls into that ALICE population, as well as households earning under the federal poverty line. So this number is combined from what we saw in those previous slides. And across the state, on average, 46% of the population is living under the ALICE threshold, which means they're unable to afford the cost of living in their area. In the Northwest region, on average, we see 42%, so a little bit below the statewide average. People are able to afford things a little bit more often. Central Shenandoah is going to be right on that statewide average with 45%, kind of what we expect to see. Northern Shenandoah and the Thomas Jefferson Planning District 7 and 10 are both coming in at 43, so just a little bit below that average. And then Rappahannock-Rappahannock, as we get closer up to Northern Virginia, we do see those numbers come down a little bit. Only 35% of the population is under the ALICE threshold.
Then with our northern region, Planning District 8 is below both the state and regional average at 33%. And then our Planning District 16, George Washington, slightly above the regional average, but still well below our state average in terms of population under that average threshold at 38%.
And then again, we're just going to call out some localities. Like we've said, the northern region especially is very varied and diverse in terms of different need in different counties and cities. So we wanted to pull out localities that had the highest percentage of their population under the ALICE threshold and also localities with the lowest percentage. So we'll start with the highest. We're going to be looking mostly at cities in the Northwest region. So we're starting with the city of Harrisonburg with 60% of that population under the ALICE threshold. I want to note that all of these numbers are above 50%. So that means that in these areas, a majority of the population is currently unable to afford the cost of living in their area. So we're looking at, again, Harrisonburg and Buena Vista, that's 60 and 58%. Popping over into our northern region, we're looking at the city of Manassas Park with 54% living under that ALICE threshold. A note about Manassas Park is that the poverty rate there is actually only 3%. There's only 3% of the population living under that federal poverty line, which means that the majority of the population in Manassas Park is ALICE. So we've talked a little bit, that population can be really underserved because there's a kind of an eligibility or a benefits cliff, where once you earn a little bit too much, you're not eligible for a lot of services. So that's something we want to be paying attention to in Manassas Park for sure. And then rounding out our list, we have Winchester, Waynesboro, and Charlottesville, all with, again, over 50% of the population living under the ALICE threshold. Now, on the flip side, we're looking at the lowest percentage of population under the ALICE threshold. These may be cities or counties where we see lower utilization of 211. It can indicate just a little bit more wealth in that area, maybe people who are more settled. And that's going to be all Northern Virginia locations here. We have Falls Church, Loudoun County, the city of Alexandria, Arlington, and Fairfax County. And those are all going to be 30% or less of the population living under the ALICE threshold. So while these are the lowest numbers in the state, I do want to reiterate, this is still, even in the very lowest one in the entire state, that's still 1 in 4 people that can't afford the cost of living in their area. So even in our areas that are the most well off, which is typically the data is going to show our northern region, there's still people that need help, and there's still people that can't afford their basic needs and their cost of living. So paying attention to those numbers, knowing we might see lower utilization, but also understanding that there's still work to do and people to help. And then this is just a map of that. So any bright orange or yellow are kind of areas we want to be paying attention to as areas of high need. So you can see Manassas Park is this tiny little orange dot up here. It is in there. And then we have Harrisonburg, Winchester. We're going to see Buena Vista, Charlottesville, and Page County all come in the yellow. So those are areas where we might be seeing higher community need, more demand for services. So we've kind of contextualized for you what these communities look like. Now that we've done that, we want to talk about our data. So we're going to be bouncing from the United for ALICE information back to 211 Virginia and talking about our referrals and the assistance that we're able to provide. So kind of keep those wealth and poverty numbers in mind as we move through. In the Northwest region, we gave just over 13,000 referrals total. And again, that's the total number of program listings that we give to somebody and can represent the amount of assistance that's available. On average, we had a 89% referral success rate, and the math on that is the referrals given over the number of referrals given plus referrals not given. So 89% leaves 11, where it's kind of like, well, what does that 11% mean? So this little graphic over here tells you about that 11%. A referral search is not always going to result in an accepted referral, and that's going to be an instance of a referral not given. So when we have a referral not given, we're going to collect some data on that. We're going to document the program type that we searched, the location that we were searching in, and the reason that we weren't able to provide that completed referral. And those reasons are all listed right here. Essentially, they can be kind of summed up with there were either nothing available, which would be in that specific need and location. It doesn't mean we have nothing in the whole directory for that need, but nothing in that person's location. The person can end the call for us, so they can just say, you know what, I'm good, I don't want any referrals. They can tell us that they might not want a specific program referred to them. If they end the call or refuse a referral, we'll document that. They can be too far away, so they just might not be able to access a resource, even if it's within the location that they told us to search in. There's some programs that's, they might not have a car with 4-wheel drive to get down a certain road, or there might not be availability to get to that program or service. And then sometimes they've already used those matching programs that we find in the directory, and they can't go back a second time. Some programs limit you to using them once a year or just once in general. And then finally, our most common reason that we weren't able to complete that referral is that the individual was ineligible for a program. So we may have found something that matched their needs, matched the location, they were able to access it. We got over all of those other challenges, but they didn't match the eligibility requirements for that program.
And then looking at Northern Virginia, oh, close to 57,000 referrals given. That is a big number. And again, referrals represent the amount of assistance available. And then with 94% average referral success rate. So that is when that's the percentage of referral searches for which the individual accepted a referred program listing. So 94% is very high, with only that 6% within that no referral given, as Mary mentioned, those reasons.
And then we're going to go ahead and look at that at the planning district level. So you might notice we're following a little bit of a formula here. We are back to our planning district level in the Northwest region. So you can see all the referrals given. You'll see that's fairly consistent across the region, fairly evenly split between the planning districts. And then the referral success rate. You're going to see an 88% in Planning District 6, Central Shenandoah. You're going to see really high referral success rates of 92 and 94 in Planning District 7 and 9. Again, kind of our Northern Virginia neighbors. And then an 83% success rate in Planning District 10. So that's our area where we're going to zoom in a little bit more, and we might have more opportunity to increase that success rate in Planning District 10.
So then looking at Northern Virginia in our Northern Planning District 8, it made up 44,100 over those for referrals given. So to think of that compared to the 56,900, that is a great deal of those referrals coming out of the Northern Planning District. And then our Planning District 16, George Washington, being over 12,700. And both of those at or slightly above the regional average success rate, both at 94 and then 95% referral success rate. So looking pretty good in that area.
Yeah, very high referral success rates in Northern
Yes.
Virginia. And these are just visualizations of that again. So this is planning district, this is volume of referrals given. You can see here planning district 8 by itself generated well over 15,000 referrals. So in that dark deep red there. In orange, we have planning district 16 with between 5,000 and 15,000 referrals. Most of the region lives in that yellow space with 3,000 to 5,000 referrals. And then planning district 9, which is just a little bit smaller, coming in between 1,000 and 3,000. Then this is our report card. So you may notice those percentages actually correlate pretty well to what you would see in a letter grade. So we went ahead and ran with it. These are our planning districts graded. So that dark green is a 93% or higher. Those are our A students. That's planning districts 7, 8, and 16. That indicates that they are very well served. Planning district 9 doing just about as well with an A minus. So doing pretty well, could be a little bit better. And then planning district 6 and 10, we're going to see earning Bs. So a B is still good. We're still doing well, but there's absolutely room to improve in those areas and get them up into that A minus or A percentages. So kind of summarizing what we've thrown at you here, taking our findings from it. The percentage of households that live under the ALICE threshold, like I said, that varies pretty widely between our northern and northwest regions. We're going to see the highest amount of people living under the ALICE threshold in cities in the Northwest region. So Harrisonburg, Buena Vista, Winchester, Charlottesville, Stanton, those areas. And then in both regions, we do see a trend that the counties appear to hold more wealth or have more people that can afford the cost of living. And then success rates, referral success is overall really good across this area of Virginia. It is our most well-served, our highest average success rates. That indicates pretty well-served communities and a wide availability of resources. However, we know anecdotally that not everybody's needs are getting met all the time. So in order to figure out why that's happening and where that's happening, we're really going to be looking at our success rates by need category and really diving a little bit deeper into those success rates and seeing specifically where gaps might exist. And that's exactly what we're going to do. So great news, we're jumping right into that. This is a graph showing all of the referrals by need category for both regions. So you can see food and meals, housing, and utility assistance are by far the biggest bars on this chart. We receive by far the most requests for those kind of basic needs of housing, utilities, and food. The blue represents the volume of referrals given, where the red represents referrals not given. So you can see again, the blue far outweighs the red in every single category, but we are going to talk a little bit more about those red sections and where we're seeing them the most. So getting into those most referred needs categories by region, we'll start over in the Northwest. And utility assistance and housing are always number 1 and 2 everywhere across the state. In the Northwest region, utility assistance is number 1 in Planning District 6, 7, and 9, and housing is number 1 in Planning District 10. Food and meals is always number 3 across the Northwest region. Individual, family, and community support is a category that deals kind of with our area agencies on aging. It'll be benefits screening, childcare, support for people with disabilities, kind of those accessory services that really support a family or an individual. That's our most referred in Planning District 6, 9, and 10, whereas healthcare is number 4 most referred in the Planning District 7, and also number 5 and 6 and 9. We know in the Northwest region, there are hospital networks everywhere. Healthcare is very well served. We have Brilliance and Terra. I live right near, I think, like 8 Augusta Health offices. So very well served, lots of different healthcare options in this area of Virginia. And then we're wrapping out with legal, consumer, and public safety. And those often deal with accessory kind of services to housing. So that can be landlord tenant, eviction, information, and it also captures domestic violence services and shelters in that category as well.
And our northern region isn't too much different at all. Within utility assistance, it's the number 1 most referred category for Planning District 16, and then number 2 for Planning District 8, and then flip those for housing. And so housing's number 1 most referred need category in Planning District 8, and number 2 in Planning District 16. And then they all have in common food and meals as their number 3 most referred needs category. Number 4, that individual, family, and community support. And then rounding out number 5, healthcare being the most referred needs category in every planning district. So Northern Virginia is quite neat when it comes to presenting this information.
Northern Virginia stays organized. We love to see that.
Yes.
And then diving into referral success rates by need category. In the Northwest region, I do first just want to draw your attention to, we will have some categories with an asterisk next to them. That means that that category received a low number of requests, so usually less than 15 or 20 requests. And so, of course, when you have a lower number of data or data points, that percentage is going to be more affected. So take those percentages a little bit with a grain of salt whenever you see an asterisk next to them. But in our Northwest region, we're going to see a good amount of need categories. Remember, there's only 17 of them. So this is a pretty big list that have 95% or higher referral success rates. And those are going to be employment, food and meals, and government and economic services, all with 97% success rate, healthcare with a 96% success rate, and then information services, individual, family, and community support, and mental health and addictions all coming in with a 95% success rate. So a pretty substantial list in Northwest.
Then for Northern Virginia, a good list as well, and a few basic needs, which we love to see on with the highest referral success rate. So you can see that all of these categories fall within 97 to 100% above that regional average for these needs categories. Arts and culture and recreation, 100%, information services, 99, employment, 98, food and meals, 98%, utility assistance, 97%, and then government and economic services, 97%, keeping in mind with arts and culture that that percentage can be affected by a low number of requests from the needs category, but 100% is 100% there. So we were glad to be able to connect at least someone to arts, culture, and recreation and those communities.
And we know Northern Virginia is a great area for programs in that need category. Definitely a lot to access.
Yes, you're guaranteed a field trip at least once in your life if you're a student of Virginia. Yes.
Exactly. And then kind of flipping, looking at the other side of that, these are our need categories with the lowest referral success rate. So again, we have that state average and regional average here just for your reference. And again, anything with an asterisk, in this case, just disaster services, is affected by a lower number of requests. So transportation, we're seeing at a 61% referral success rate. This is going to be a little stark. It's going to be a little shocking compared to the numbers we've been looking at. It does look this way kind of everywhere in the state. Everywhere else is staying consistently at least above 70. Transportation routinely falls between 60 and 70. Disaster services in Northwest comes in at 73%. Disaster services is one we take a little bit with a grain of salt just because the landscape of resources and service provision changes so rapidly in the case of disaster that we may have someone call one day and have to document a referral not given. And if they call us back the next day, we may have 5 or 6 resources available for them. So it can really change day to day with disaster services. Then rounding out the category, income support and assistance and clothing, personal and household needs, both coming in under 80%. And then we're getting back up to the numbers we more want to see with housing coming in at 84%.
And then for our northern region, most of those staying above that 80%, but looking at the needs categories with lowest referral success rates, again, transportation at 68%. I think of transportation to stick out because it's a means to an end. And so it's also, and what else is the barrier that they can't reach when it comes to transportation being a low referral success rate. Obviously, you're not just needing somewhere to go nowhere. Like there's a means to that end. So that's I think why transportation always will stick out and be so important too, is what barrier or what are they unable to access because of transportation. And then income support and assistance, 77%, clothing, personal, household, 83, and then education, 88%, and volunteers and donations at 89%.
Yeah, and just to highlight once again, this area of Virginia really is well served. You can see these last two, education and volunteers and donations. These are the lowest success rates in all of Northern Virginia, and those are still at or above the statewide average. So we're doing pretty well with our ability to give referrals in the Northwest and Northern regions. And I'm going to summarize that for y'all. So housing and utility assistance, you'll hear this all day if you're with us all day, are by far the most referred needs categories, followed by food and meals and individual family community support. Healthcare makes an appearance in Northwest and Northern Virginia. It is a prominent need in both regions. It makes the top 5 most referred needs categories for 5 out of the 6 planning districts we're talking about. So a pretty prominent need. And then referral success rates were lowest for our categories of transportation, income support and assistance, and clothing, personal and household needs, which can indicate some potential resource scarcity in those categories. And that brings us to the end of this section. So I'm just going to finish with some quick call to actions and links for y'all. I believe Amanda will be dropping them in the chat as I'm speaking. We may also have them available from last session if you just scroll up just a little bit. So our planning district reports are available to go through. They contain a lot of the information that we reviewed today, some different charts and graphs, and also get a little bit deeper into planning district specific information. So you can scan the QR code to download those or visit the link that's coming up in the chat now. And then some calls to action. So how can we make these numbers better next year? First, we can increase awareness of 2-in-1 Virginia. You saw in those community utilization slides, those blue counties, those are areas where we really want to make sure people are aware of our services. So if you work in those blue counties, or if you kind of work anywhere in these regions, we would love to get your help spreading awareness. We can ship materials to you completely for free that you can hand out to clients. So you can scan the QR code or follow the link in the chat to get that. And then we also obviously need some more agencies in our directory. And we showed you kind of the need categories and the areas of Virginia where we're really hoping to recruit more agencies if they exist. And so if you can think of an agency that serves that transportation, income support, clothing, personal, and household needs that maybe we don't have in our directory, you can recommend them via the form, either at the QR code or in the chat. And then finally, please utilize our data. We like to offer this data to inform decision-making, strengthen your funding proposals, strengthen your grants, and enhance your service delivery. So if you're thinking about a new program, maybe you've gotten a grant and you have a little bit of freedom to play with the funds, maybe refer to this data. We're happy to sit down and talk with you about what needs we're seeing in your community. We know we have some elected officials or representatives from their offices on the call today. Thank you so much for being here. We are also happy to sit down with you and kind of chat about the need data we're seeing in your communities on a deeper level. With that, I get to be a little bit quiet for a minute. I'm going to stop share and we are going to take any questions. We have about 15 minutes before our next session starts. And we are also happy to go back to any slides, re-show anything. We know we throw a lot of information at y'all in these sessions.
If
Thank
you've
you,
been
Jessica.
around all morning, you may have had your questions answered too. So.
Thank you, Jessica. That's good to hear. Thank you, Sarah.
Great to see Sarah. Had a great conversation with Prince William County. So, yeah.
Yeah, and we know we got to highlight Prince William County a little bit today. So I'm glad we got some representation from there. And I'm just scrolling through who's on the call, and I'm seeing a lot of people that we've gotten to collaborate with in the last couple months. So thank you guys so much for being here. It's good to see those familiar names.
I do receive the material requests in real time, so I have seen them come through today. So that's been exciting for sure.
Absolutely. We have a questions, but they're very specific. Absolutely. We'll chat. Douglas, you and I have been in touch. We'll continue to be. I'm happy to be. And then can we discuss the southern part of Virginia, Petersburg, Dinwiddie, Sussex, and Surrey? You are setting this up so perfectly. That is going to be included in our session that starts right at 11:30. That's part of our East Central region in our region. So we're going to be covering that in just about 10 minutes here. And I realized what we didn't put was our contact information. So I'm going to go ahead and put my email in the chat. I can be your primary contact for both regions for now. I'll get you connected with our colleague Darian as needed. But please do feel free to reach out to me with any of those specific questions. We're always happy to help.
I'm also going to link our homepage to our 201 University. If you scroll to the bottom, you'll see all of us. So if we didn't give you the former, you'll have our phone number and email addresses. And then also a quick note that all of this is going to be turning into one great site in the new year. So we'll have 211virginia.org that will both have the kind of agency resource side of things and then also our searchable directory all on one. So get excited because we are about that change coming for 2025. So all of this information that we share will be in one spot soon, which we're grateful for.